Hi, this is Sandy Severson, Senior Vice President, Care Improvement with the Arizona Hospital and Healthcare Association. I'd like to take a few minutes and tell you about a new program, grant funded for COVID patients. It's a palliative care telehealth program that we've been able to obtain a grant. I'm going to just share my screen here in a couple of slides. So why did we start this program? We started it as a result of our healthcare system being overwhelmed by the high volumes of COVID patients, and that we were seeing a tremendous amount of suffering. And we felt strongly that if we could treat patients who were having suffering in their homes, they wouldn't have to go to the hospital. So we really wanted to reduce that surge. So palliative care is a medical specialty, so it's anyone who's got strong or very challenging symptoms of COVID, the cough, the malaise, the chest pain, the shortness of breath, and a referral has to be done by a physician, nurse practitioner, or PA. It's all free. This is the website here, and our goal is to actually help patients live as well as possible in their own care settings. So what services or can do referrals? Home health agencies, a clinic, primary care docs can do it, and patients can get the referrals in their homes. Hospitals where palliative care is not available or actually is limited due to high capacity. But our target audience are really the underserved, those that don't have access to palliative care, the long-term care, the skilled, the long-term acute care, the rural areas in the state. In the bottom left is the palliative care referral criteria for COVID-19 from the Centers to Advance Palliative Care. These are just recommendations. Anyone can actually be referred that you feel is appropriate. On our next slide, we're going to talk through the process for the referral. The provider, a nurse practitioner, PA physician would identify a patient who's got severe or chronic symptom management or goals of care, a patient that could benefit from that, and then discuss that with the patient and get informed consent that they would want to have a palliative care consult. They would make a referral via this link, and they would complete a brief referral form or an intake form that would identify how the palliative care agency can actually access the patient's medical records. We need an H&P, a discharge summary, the medication list, any consult notes, that type of thing, x-rays that are recently available, and what the goal is for the palliative care consult. How to reach the patient, what care setting the consult will be occurring in, schedule that, and then your information or where the report should go back to, where the palliative care provider should make the call to. So then a medical assistant will actually obtain those medical records and schedule a time and a venue for the consult. If a device is needed, we certainly can ship those out overnight, but the consult can occur via a smartphone, a laptop, any sort of a computer that has internet access to it. But devices are available and they do not need to be sent back. Once the consult occurs, and it can occur with multiple family members, it can be multiple consults, because we know that it's always not just one visit, and family members and providers can be included in that. Then the recommendations for medication changes or goals of care or completed documents, the living will, healthcare power of attorney, those will be sent back and a phone call will occur back to the referring provider. So this is the link to do the referral. On that website is frequently asked questions for healthcare professionals, and then also frequently asked questions for patients, loved ones, and families. There's a flyer that can be downloaded and given to patients. You can print those off in your care setting and provide it so that it can be shared, or you can send it via an email as an attachment to family members, and some basic program information. Again, this program is being offered free of service by the Arizona Hospital and Healthcare Association. If you have any questions or would like a phone call to discuss or kind of clarify the process, feel free to reach out, and please stay safe.